Today we are going to talk about the protein energy malnutrition. The protein energy malnutrition that are Kwashiorkor and Marasmus. So Marasmus and Kwashiorkor are two protein energy malnutrition that occurs if the child has deficit in protein or calories. So Marasmus and Kwashiorkor are two different entities. The marasmus you have to understand is that marasmus occur if there is deficient in calories but no nutrients are entirely absent. That means the child is having nutrient, the child is eating, but the child is having not enough calories and not enough nutrients. Where the other hand in the Kwashiorkor occur if the overall plasma oncotic pressure decreases and there is liver malfunction due to deficient protein and deficient calories. So in the Kwashiorkor there is overall deficient in protein and overall deficient in the calories. So now let us discuss the clinical findings of the marasmus and Kwashiorkor. The occurrence of the marasmus is more common than the Kwashiorkor. So the marasmus is more common whereas the Kwashiorkor is less common. So where do we find edema? In the marasmus there is no edema. There is no edema, but in the Kwashiorkor the edema is present. The edema is present due to decreased plasma oncotic pressure and liver malfunction. There is in the liver there is fatty change due to apolipoprotein synthesis. So there is edema. The edema typically present first in leg, then it gradually progresses to whole body. What is the activity of the child? The child with marasmus is active, whereas the child with Kwashiorkor is apathic. The appetite in the marasmic child is good, but the appetite in the Kwashiorkor child is poor. The child cannot eat properly in the Kwashiorkor. There is hepatomegaly. There is hepatomegaly in the Kwashiorkor, but there is no hepatomegaly in the marasmus. The mortality is less compared to that of Kwashiorkor in the marasmus, but whereas the mortality is significant high in the Kwashiorkor. The recovery is early, but the recovery is slow in the Kwashiorkor. The marasmic child is less prone to infection compared to the Kwashiorkoric child, but in the child with Kwashiorkor there is more chance of infection. So these are the various clinical findings and clinical pictures we see in the child with marasmus and Kwashiorkor. I hope you understood this lecture. Thank you.